Welcome to Oral Wealth Prosperity and Practice Podcast. For another episode, we have two guests today I'm excited about. This episode is going to be kind of an introduction to the idea we've been discussing about having a business of healthcare mastermind. And we have two great dentists, Dr. John Edmunds and Dr. David Marsh, here to kind of tell their story. Hopefully we'll provide some good tidbits to our listeners, whether they're new dentists or whether they have, a successful practice. So we're excited to have you today. Thank you guys.
Yeah, man. Good to be here. Absolutely. Thanks for having me.
Yeah. So first we're going to start out with a little intro for each of you. We'll start with Dr. John Edmunds. So welcome. Can you tell a little bit about, where you are today and kind of your story of how you got here as a dentist?
Sure. So this is my little over 4 years in practice now. It goes back as far actually as fifth grade. I know I started shadowing my childhood dentist. It was at least ninth grade. It could have been fifth grade for all I know. But thought he was just a really cool guy, seemed to really enjoy his job, was well known around town, gave back to the community a lot. So we started talking a lot, started saying, hey, if you want to go to dental school, it'll probably be about the time that I'm ready to retire. Ended up going to Clemson, continued to come home, shadow him while I was home, learn a little bit while I was there. Was blessed to get into dental school. And then things got a little bit real. Figured out what I wanted to do. I didn't know if I wanted to specialize. I didn't know if I wanted to do residency or just go straight into practice. Second year into dental school, I think that's when I pulled the trigger on general dentistry. I do want to go back home. That's where my family was. That's my hometown. Love my hometown. So we kind of made a handshake contract, which you don't really see much anymore, but we did have something on paper. Ended up going back home with him, practiced with him for a year. He retired at age 76. He was a well-oiled machine. So I've been practicing solo for 3 years now. Coming back home, other than marrying my wife, best decision I ever made. So
yeah, in Clover, South Carolina. Is
Clover,
practice,
South Carolina.
Right? Yep. Tell us a little bit about where the practice was when you started. 76, I'm guessing.
Yeah,
he was slowing down, had a decent client base.
He was still cruising pretty good, believe it or not. He was probably seeing more patients than I see in a day, but he had a very large patient base, still paper charts. He did have digital x-rays, but everything was still on paper. Was sending out postcard reminders in the mail. So we updated a lot when I came in after I bought it, but just a well-established practice, good patient base, and he had a good name. It's just we're in an area of town that's not really visible. No real roadside frontage on like a busy highway or anything like that. So word of mouth is huge where we are, but a great practice to get into.
Right. Yeah.
Good opportunity.
Sounds like a great one. Yeah.
Thank you. Awesome.
Yeah. And we'll share.
It sounds like it.
Yeah. We'll share more about where you from there to where you are today, later in this podcast, but we'll go to Dr. David Marsh, give a little bit about your background and
sure
how you got here.
Yeah. So I grew up in a little town in Gaston County, North Carolina. Similar story, right? So it was really, really cool to hear. Like, it started with my growing up dentist. Kind of was a nice guy, kind of took me under his wing and let me be a little nosy and sort of poke around and what's going on, and got me really interested. And he fired me up. Yeah. So then I had that focus going into school. Went to undergrad at North Carolina.
Right. We got to clarify.
Right. Yeah. The original Carolina. and then from there, I kind of got my priorities lost, took a few years off, met my now wife, and realized, like, oh, gosh, I got to get a better job than what I was doing then. So then I brought up dentistry. Was fortunate to get into dental school. I went to dental school out of East Carolina. From there, I'd been working a few years, and I was realizing that dental school is expensive. So I looked at ways to pay for it, and just so happens the United States Air Force has a great way to pay for it. So commissioned with them, did a residency and a few years active duty. And then from Texas, where I was most recently stationed, I decided that I was done with big group practice, which is the military. And
the biggest they get.
The biggest they get,
Yeah.
right? And I was the most junior associate they had. Right? So I was ready to be done and wanted to own. And so I started looking sort of back home. My wife is from Chapel Hill-ish. And so we were looking in sort of concentric circles around Belmont or Gaston County or Chapel Hill. And so we just started cold calling dentists of a certain age, looking for opportunities, looking to see if they had an exit strategy or if they had an associate, and if I could be of assistance. I'd love to have a conversation. If I couldn't be of assistance, I'd still love to have a conversation. Met a couple of great dentists around the state that were an awesome opportunity, and then just honed in on this one in Belmont, which is ran by a fantastic dentist in a great location with a growable practice that I thought we could really have a lot of value to add. And so that was about 6 years ago that I bought the practice. We ended on a handshake agreement, me and the selling doctor, that he could work for me as long as it made financial and personal sense for both of us. And he's still there. He's still there 2 days a week. So it's been a wonderful relationship that we've gotten to accidentally cultivate over the last 6 years.
Yeah.
Awesome.
Yeah. Go into, because I think this is a really unique story, like go into more details about how you went about getting the names of dentists and then what you actually did. You literally cold called them.
Yeah, literally cold called.
Yeah.
I mean,
it's warmish because you're a dentist.
Well, yeah, it's not cold call like I'm trying to sell you something. It's literally me cold calling you because I really genuinely want to know about your experience. So I got a list from the North Carolina Dental Society, which at that time was free. I think
it's free for dentists still.
I just looked it up.
Oh, okay.
It might not be. It's a nominal charge. I was talking to a girl yesterday at UNC that telling her the same story, and she said it's not free. So I have to look into how much it costs.
It's not expensive.
Then it was free for dentists. And so they give it to you, all the list of the licensed dentists in the state for free in a Excel spreadsheet, their name, a couple other details, demographic details. But importantly to me was the graduating year of dental school, or I guess it would have been the licensing year that they got licensed in North Carolina, which is roughly the same. And the zip code, right? So then I started organizing the spreadsheet by zip code and graduating year. So I found, for lack of a better term, old guys in the areas I wanted to be.
Exactly.
And then started researching from there. I shortened the list down to a couple of dozen, a couple of quick Googles gave me, that guy's an oral surgeon. That's not my jam.
Mm-hmm.
This guy's like the senior doc in a giant practice, probably has a good exit strategy. And so I started looking for the solo docs or the docs that didn't have a website, which is a good indication.
Yeah.
Right.
Yeah. It was a good indication that they're probably ready to move on.
We didn't know either.
Then you cold call and then you just say, hey, here it is. And talking about this guy had awesome dentist, really good guy, but no digital anything, paper charts. In fact, one of the first tasks I had to do when I got this practice, I had to fight a creditor or a debt collector from the Yellow Pages, because I didn't know that we still had an ad in the Yellow Pages. And I was like, you had the same problem. They are relentless, these guys, man. They wanted like $900 from me. I'm like, they need $900 for a Yellow Page ad.
Yeah. Nobody uses the Yellow Page.
Show me where they were printed. Right. And I will give you the $900.
Yeah, I love that story. I think it's really unique. And it just shows your confidence and desire to find a good practice. Like most people wait around and wait for those opportunities. Yeah. And those don't, like a lot of the good practices don't come to market.
Right.
So we'll stay with you, David. First of all, we forgot to do this. Cheers.
Oh, yeah.
Yes.
Cheers. Always.
As the first official mastermind that we're on the podcast, we're going to enjoy this sip. And this is a no judgment sign. So,
right.
But yeah, there you go. So first is we're going to start with the good stuff, right? So what's one area of your practice right now you feel is really thriving? And then the second part is what strategy or initiative that you're proud of that's working well for you?
So right now our practice, I feel like the culture of our practice is really jiving, right? So I I can't take full credit for that at all. That's sort of what I inherited. We just sort of took that culture and it fit with my personal culture and my personal personality that it just worked well. And so we took that and ran with it.
Yeah.
Our location in our small town, it's a small town with a sort of a small town square that's centered around a park. And we're in that same little square. And so in that park square, they host a myriad of events nearly every weekend.
Yeah.
And so part of our desire of just citizens of the town is to be a part of the town, a part of the community. Not just as a dentist, but just as a church member, as a patron, as a civilian in the town. We kind of wanted to lean hard into that. So our marketing strategy from the beginning, I guess, is a marketing strategy.
Community based
marketing, right? So we don't put our name out there and say, hey, come to us because we do implants or we do the cheapest braces you can find. We're like, hey, art's across the street, cool, that's us. The bookshop who's supplying the books for the kindergarten readathon, we'll buy those for the kids who can't afford them, right? So that kind of stuff where we're really just diving into the community. And it sounds selfish to call it marketing, but from a business standpoint, it works out for us. But really what it is driven by is just, I've got these marketing dollars, might as well spend them to help kids have a book or the concert to come to the park across the street. So for us, that jives well with our culture, and that culture and that marketing are working really, really well hand in hand. Marketing, I'm still going to use big air quotes.
Yeah.
Marketing.
And we talk about the culture. Usually when you buy a practice, there's a lot of turnover, but
Correct.
You did not have a lot of turnover. There was a few. Yeah.
Well, we bought the practice.
Yeah. You've expanded.
We've expanded and we bought the practice right before COVID. So that's a whole nother conversation we can have at a different day. Bought the practice. 2 months later, we shut down for COVID. And
Great timing.
Really, really good timing. And in that transition, in the transition because of COVID, we lost one hygienist. She was pregnant and she didn't want to come back to work. Other than that, we've had complete retention. We've added and expanded. And I really attribute that to like my relationship with the selling doc, right? So he and I saw eye to eye and treatment philosophy and community philosophy. And then he also didn't push back on some of the major technological and treatment planning growths that I had planned for the office. He got excited about it. And then he got re-energized to get behind it. So in that stance, I'm very fortunate. And I thank him a lot. His name is Jerry Duren. He's fantastic. I'll shout him out. That to his credit, he stuck by us. And because of that, we had very low patient turnover and zero staff turnover.
Yeah, that's a gift, because usually you see it's just hard to find a practice that has that kind of natural fit.
It's a blessing.
So there's a lot of turnover when you purchase another practice. On the marketing side, what is there one community thing that you've seen provide kind of the most turnover? I know it's hard to track, or most
benefit.
Yeah, benefit.
Yeah, it's hard to track because a lot of it are existing patients who get more fired up that, hey, we're there where they are. But I think the most thing that I can count, there's a concert series called Friday Night Live, right? So it's all summer. There's 8 or 10 concerts. And it's a variety of different bands and cover bands. And so we were one of the top tier sponsors for that for several years. And for the first several years, she doesn't have anything else to do. So I'm going to go out there and have a book bag full of koozies with our stuff on it. And I'm going to stand near the beer tent, and everybody who comes out, hey, here's a koozie. Your beer looks warm. Enjoy this. And for months into Christmas and beyond, long after the concert series has ended, welcome, new patient. How'd you hear about us? I'm not really sure. I was drinking beer in the park and some guy handed me this koozie. It's well,
yeah, it's probably me.
Probably me. Yeah. Or my dad, who also out there advocating for us. So
I did one shift.
Yeah, you did one. You were out there helping out, slinging koozies.
Yeah, slinging koozies. Better things. Better that could do worse things.
It's a better way to spend a Friday night.
Yeah.
There's also worse ways.
Yeah. Yeah, that's exciting. So we'll move to John. Same question. What's one area of your practice right now that's really thriving? And then I guess a strategy or initiative that you're proud of that's working well.
Sure. Very similar to you, actually. Zero staff turnover.
Awesome.
I am biased. I think I've got one of the best staff out there. Kudos to the doc before me, Dr. Herhan. You did a great job. I mean, they're all best friends, not only inside the office, but outside as well. So fortunate that there's no turnover, there's no drama. It's a very great environment, not only just for them to work in, but when everybody's happy inside, the patients can see that.
Yeah.
They hear the laughter. They hear that, we're enjoying our jobs and where we are. So I'm very thankful for that. Something we've done well at. And when I say we, I mean them, is embracing change. When I came in, he was still there, kind of running under the radar, still paper charts for a year while I was there. But as soon as he retired, I probably pulled the trigger a little too quickly on changing some things. So we went to a new software system. We got Open Dental, so no more paper charts. We went digital there. We got a new phone service, so we can text patients, text reminders. We got a new X-ray software. I mean, that was all within 3 months. They were a tough 3 months, but the girls, I mean, they handled it like a champ. Learned it very well. So I'm very proud of them for that and their openness and willingness to change. Specifically for us, though, I'm very proud of our collections at the moment. Not just what we're doing. I'm talking about just being up to par with what we're producing and kind of collecting what we should be collecting.
So you're close to 100%.
Right, correct. Not sending out as many paper statements, trying to track down money. So just little things like that. We're trying to get better with our systems. But in terms of patient experience, I couldn't be more pleased with how the office runs.
Yeah,
They do a great job.
Yeah. I mean, you mentioned a couple things. One is, I think a lot of people underestimate how happy staff equals happy patients.
Yes.
You hear horror stories where patients are overhearing, people argue or people talking bad about somebody after they leave the room, and nobody realizes that that's going to affect the patients. Right.
Right.
And it's hard to fire, right? You're like, oh, they do a good job, but they're ruining they're making everybody else unhappy.
Yeah.
Yep.
So, that's a lot of struggle I see is people like buy a practice and they're like, well, she's been here forever, but they don't she didn't get along with my new hygienist or, and you just can't have that. Right. You got to make
an the bad apple.
Yeah.
Yep.
Cause it ruins the whole experience. And the other thing, I guess the other question I had was, talk a little bit more about like how you transitioned. And I guess same thing with you, like how you transitioned to digital patient files. So was that like as they come in, update them, or do you just updated them all at once?
We floated the idea of scanning stuff in. That sounded like a ton of work. We did not do that. I still have, patients of record. You got to keep them for X amount of years. So while, yes, we still have paper charts over that first 6 to 8 month period, as patients were coming back in, we treated it kind of like a new patient exam where we updated everything in the computer, charting, medications, whatever it may be, to update their file as like a new patient. It was a long 6 months, and that was tough for everybody. I mean, front desk, hygiene, me. I mean, everybody.
They're not used to computers, and now they have to use computers.
No, so I mean, it was tough looking back, but I'm still glad we didn't scan anything in. I mean, I've still got that, and I've got to keep those paper copies for as long as those patients are A, alive, and B, are patients of mine for X years after I may not see them again.
Yeah.
I think that's a whole lot less of a headache for my team to deal with.
Yeah, and it's also, you could also hire a company to scan it out, but it's expensive.
It is.
Yeah.
It is.
What about David?
Man, we did the same thing.
Yeah.
Yeah.
Same exact thing.
The only thing different is I had I'm real big on, if you want to come shadow me or our office, then we're open doors, right?
Yeah.
So
Likewise,
if we want somebody to come in and learn from us, we welcome that. And so we had an assistant that wanted to come and learn for a little bit. And she was like, I really don't think I like chairside as much. I think I'd really rather look at more administrative up front. that's an awesome recognition to have such an early
on.
Yeah. And so also at that time we had a task looming over us, like how do we purge all these records that we haven't seen in X number of years? And so this wonderful child, she volunteered. She wasn't like tasked to do this. She's like, well, I can go through all those records. And for over the course of a week, for 8 hours a day, she just looked at every record and pulled every chart that we hadn't seen. And I forget the timeline, but whatever it was. And we added a couple of years just to be
7
safe.
years, 5 years.
Yeah. I think we were in the 9 or 10 year range just to be on the safe side.
Oh, yeah.
And so she just pulled every record, and we ended up purging like 70% of the records we were storing for no reason, which freed up a ton of space. So we're doing the same thing. We're sitting on records until those patients are no longer with us, or they age out, or they
come in.
Yeah. And so, every year, well, I don't say every year. Our goal is every year. It turns out so far it's been every year and a half or 2 years. We'll go through those records again and find who was next out. Yeah. And then we'll purge a few more records, or paper charts.
Correct.
Same as deactivating them on your Eaglesall software. It's deactivating them on a digital or analog world.
Yeah. It's funny how you guys have not met before this time, and how
we met like an hour ago.
Yeah. and how similar your situation is. So, let's switch a little bit, kind of more like, this is a little bit more vulnerable conversation, but now we'll start with you, John. Let's talk about the other side of the coin. What's the single most pressing issue or challenge you're facing in your practice right now? Like, what keeps you up at night?
Insurance, as most, solo out of network docs are. Not the point to where, I don't see a place for solo general dentists that are out of network in the future. I definitely do. There's always going to be a place for us that create a patient experience completely different than in network corporate dentistry does. Mm-hmm. That being said, and I don't know much about it. I myself could do a better job in figuring out, what exactly is insurance verification, how it works, how you do it, when to do it. So that's something that we're navigating to be better at, to figure out. So finding some CE courses for my front to take, because like I said, it was, we'll see what insurance pays and then we'll send you a bill. Yeah. That's not really going to cut it anymore. So how do we figure out to a T, what insurance is going to pay or supposed to pay, collect the patient portion, as they're leaving. And, if there is a little bit left, it's, hopefully no more than $10, $20. And when we're not, hundreds of dollars away. Oh, right. Yeah. Exactly. So that's something that we're trying to learn more about, but because we're an older office, we've never really known much. So we're learning as we go. Yeah.
So you're not, you don't take any insurances. You're out of
correct. So we'll file it on the patient's behalf,
but
but not in network with anyone.
Yeah. And you started that way.
That's the way he had it. Thankfully, very fortunate. And then that's the way we're going to keep it.
Yeah. Definitely. Yeah. That's good. Anything else worth talking about?
None that comes to mind.
Yeah. I guess it's not a challenge, but what about space? Because you mentioned that at the beginning.
For sure.
Yeah.
So we had 2 docs in the office we're in now. Now it's just me. So yes, it's comfortable, but it's not routed properly. I mean, the waiting room is lobby, whatever you want to call it, is way too big. You could fit probably 2-3 ops in the space that's in.
Wow.
Everybody enters the same way they leave. So there's kind of like a bottleneck at the front. There's no easy place for me to sit down with a patient and just talk about treatment unless it's in an op. Mm-hmm. And then you're using that op space to just have a discussion. Lab space, we're hurting for space. It works.
Yeah.
But it's just not ideal.
Yeah.
So it's something to work toward.
Yeah. Right. Because it works because you've increased production significantly from the doctor leaving.
Right.
Yeah. So that,
like I got a CEREC prime mill, prime scan oven. All that's in my office. I mean, we don't have
private office
space to put it anywhere else.
Yeah. Yeah. And you've considered, upgrading.
Yes.
Upgrading the space.
Yeah.
And that's, ongoing conversation.
Ongoing.
Yes.
Yeah. Got a lot of debt over my head at the moment. But,
yes.
Yes.
The story of all dentists.
Correct. Correct.
The downfall of 100% financing.
Yeah.
The downfall.
It's a continual work in progress.
Yeah. Yeah.
In a good way.
Yeah. We'll all celebrate the day where each time we here, this is what we'll celebrate with. Each time we pay off a significant loan, we'll pour a sip. So we'll switch to you, David. Same question. What's the most pressing issue, challenge facing you or your practice today?
Yeah. So, I think, really honestly, my two tops were insurance and space, right? So, similar to you, right? But the practice I had was a network with a few, and we've culled the little ones. That was pretty easy. We got one big behemoth we're staring at and trying to figure out the difference between our growth and just continuing to support our growth. So the backstory of that is like we've got a couple of hygienists that are near retirement, which is their blessing, and I'm so excited for them to move on to the next phase and to enjoy their families. But from a practical standpoint, this brings me to my other problem, right? So we've got a space problem where we're tight already. I've got an insurance problem where we're in network with an insurance that are cutting me down by 30 to 50% on a lot of procedures. So, the third option of that is I could replace this hygienist with another hygienist who is excellent, top of her game, really great with our patients, and she's a fill-in for us. So we know she's a wonderful cultural fit. Could I hire her and fill that gap? Absolutely. Or can I let this retiring hygienist sort of go and then drop the insurance, take the attrition, and then use that intentional shrinkage to sort of start to regrow. So, I'm at a bit of a crossroads. There's a little bit more complication in the ins and outs of the staffing. So the staffing ins and outs, I've got one girl is pregnant, one girl's retiring, another girl retiring in the full time. So there's lots of like personnel management. So between the space and the insurance, my added complication and to my biggest pressing problem that keeps me up at night is this personnel transition where I have
do you combo with driving insurance?
So how do I leverage all three of these together? I'm not sure. And I've never had any experience with the personnel issues. These aren't like,
and should you need to replace, at least you have a very good option.
Absolutely. Which is a blessing of itself, because to have extra hygienists knocking at your door, like these are mythical creatures that are floating around the fairy world, right? So
far and few between.
Yeah. Everybody else can't find them.
Let me knock wood.
Yeah.
I've had great luck in hygienists that we've been very fortunate with people who are dying to come work with us.
I mean, it also speaks a lot for your culture.
I think so.
100%.
Yeah.
And it's the culture that Jerry built and the culture that our team has really propagated and the culture that our patients just love.
Right. Yeah.
And that's there. It feels like home. It feels like friends. And so we're leaning into that.
Yeah. You're talking about staffing issue. We'll have asked you, actually, both of you guys this question. Tell us kind of what your current setup is, like hygienists, assistants, front desk.
Sure. We're a 5-op, right? So just to kind of paint the picture, we're 5-op. It's me and Dr. Duren, who's working 2 days a week. I'm 4 days a week. He's 2. We each have one assistant.
Okay.
His assistant's 2 days a week. My assistant's 4. Connie's awesome. Crystal's awesome, but Connie's my assistant. And then I've got 2 front desk team members. They're not front desk team members. They aren't furniture. They're administrative and reception professionals. Then we have now we have 3 hygienists. Of those, 2 are full time, 4 days a week with me. The retiring one is 2 days a week, sort of with Jerry and Crystal. So we've got a part time team, sort of, if you want to compartmentalize them, and a full time team. But we try really hard not to categorize in that fashion. We try to,
but that's how it functionally.
That's how it functionally works.
Yeah.
Right.
Yeah, John. What about you? What's your setup?
16 members. Let me back up. 5 ops as well.
Okay.
It was kind of 4.5. We kind of converted little space into another op just
Good
to
for
be
you.
able to use it
Nice.
efficiently and make use of that space. But 6 team members. So I've got 3 hygienists, I've got 1 assistant, and I have 2 up front. That being said, one of the ones up front can also assist. One of the hygienists can also work the front, do insurance, and assist. So as team members are out on vacation, whatever it may be, they can
Lots
cover
of
for each other
cross-training.
really well.
Yeah.
Yeah. So it works great. Now that being said, the third hygienist, she's paid as a hygienist. Her salary obviously is higher. That being said, just even though she's not cranking hygiene all day, every day, she may be assisting or helping with the delivery or an extraction or at the front. She's well worth her money.
Yeah. And they're all three hygienists full time.
Correct.
Yeah.
Correct. Yeah.
And typically, I mean, you can't keep, as one dentist really can't keep 3 hygiene full time going.
Yeah,
It's hard.
That would not be fun.
Yeah.
Yeah.
What is the law in South Carolina? Can you have 3 hygienists running under you?
That, and then so like if I wanted to take the day off or it was last minute or something, I technically can be gone, and they can still run hygiene pending that patient has been seen within the last year.
By
So-
you.
Correct.
Okay.
Correct.
Wow. That's
Yeah, which is
That's
very
beneficial.
nice.
Was that a new change?
No.
Okay. That's been around for a while.
Yeah.
I actually didn't know that rule.
yeah.
What's the rule in North Carolina, just for the
North
audience?
Carolina is 2 hygienists per dentist, period. You have to be in the building anytime they are actively scaling a patient.
Yeah. And you have to review it. Like there's no
Yeah.
independent,
Right. Yeah.
there's no independent hygiene.
Yeah, they practice under my license. Well, something.
Yeah.
I don't know the verbiage, but yeah, I know I have to be there.
Right.
Yeah. It's a
In the
That's a
office.
big difference. In South Carolina, you can't have hygiene production on its own, though. It has to be like you can't just set up just hygiene
Or
dentists.
hygiene practice standalone.
Maybe, yeah, or
I
hygiene practice
have no
standalone.
idea.
That's because
That's a great question.
yeah. And this is a question: is your hygiene profitable at the current rates of hygienists?
Yes.
So it could be something to look
Yes.
into, right?
I mean,
But-
when I'm not there, it's kind of like a wash day.
yeah,
At best, because a lot of people do want to see the dentist,
Yeah.
which is great, and I appreciate that. But it's nice to be able to stay open.
yeah, that's sweet. Yeah, this is very helpful. Like I'm assuming this is great insight for the listener, especially our younger listeners. As we wrap up, we've set this up as kind of our first test for the mastermind idea. We're actually, us 3 are meeting again in October for the first official mastermind, where we're going to figure out, what's the benefits. Like we talked about this, right? Is you guys get a lot of clinical CE, right?
Mm-hmm.
You learn a lot on the clinical side in dental school. Most practice management courses are jokes at best.
Correct.
I heard some of them are getting better, but historically they're not great. Usually, like I think in Carolina, it's right before you need to start studying for your like end exam.
It's too late.
Yeah, or too late.
Yeah.
Should already have something
Yeah.
lined up.
Right.
Too early. Yeah, or too early because you don't care about it yet.
Yeah.
Like,
Yeah.
so, we wanted to form, we wanted this podcast and that mastermind to be a place where dentists can, and, other healthcare professionals that want to own to get together and talk about the practice management side, the stuff that you can't find CE for a million places, like clinical side.
Right.
So, we want to wrap up with kind of, I guess, one piece of advice that you would give a dental professional who is just starting out, or one that might be facing similar struggles. So you can answer both. Like, what would you tell to a new dentist that you would, that would fix the problem in the future? And then what's one piece of advice who might be struggling with the similar things?
Yeah. So for me, 100%, I would say, you do clinical stuff all through dental school. That's all people ever talk about. But I would say invest at least the same amount, if not double into, the culture, your team, your systems in the office, to provide that patient experience.
Yeah.
Everybody, whoever you have in the chair, they don't care what your crown prep margin on the 30.
How many panky
looks, how crisp it is.
They don't need a 20 micron margin.
They don't
please
know.
The patient.
They
I
don't.
need a 20 micron margin to please me. The patient does not know.
Exactly.
I don't know what that means.
They remember the experience. So investing in your team, investing in the systems that make your office what it is. That's the importance to me.
Yeah.
Not the clinical stuff.
Yeah, the clinical stuff. But you still are doing the clinical stuff because we're, as all of us are lifelong, anybody listening to this is a lifelong learner. Like you can never learn enough, but it's one of those pieces that's missing.
Right.
Right. So hopefully this podcast and this future mastermind we're developing together would provide some of that resource.
Yeah. Patient doesn't judge you on, like I said, your crown prep.
Right.
They could go to the dentist, whatever. They got a crown.
Yeah.
So, they come to you and it's an experience.
So that's what keeps it from being a commodity.
Exactly.
Yeah.
Different.
Yeah. David, same question. So what's one thing you would
I
tell?
agree entirely. Right. And so my kind of philosophy and the way I phrase it is, you, in order to be successful, you have to know yourself. You have to know your patient. You have to know your work, and then you have to apply your knowledge. So
Heard that before.
It's kind of a thing somewhere. Thank you. So, to know yourself is sort of know your goals. Where are you heading? Where are you going? What is your vision? What is your ultimate idea of optimal? Know your patient is just that. You got to build relationships with your patient and know exactly what their goals and their optimal is. And how does that co-align with yours? You got to know your work. You got to be good clinically. You got to strive for that 20 micron margin, even though your patient doesn't care about it. You can't let that slide. And then apply that all together to really create this super experience for the patient. Super experience meaning what they feel that day and how long that work lasts.
Yeah.
And then how much you're willing to stand behind it because what you gave them was clinical excellence.
Yeah.
So that's my advice is like really take a holistic look at everything and know that all 4 of those little tenets are going to change and evolve for your entire career. But as long as you're paying attention to all of them at some point, at some level, you're going to be doing better and better and better and better for your patients and then yourself.
Yeah. And, we're all business owners. We can't perfect everything all at once. Right. So maybe you'll focus on getting clinical ready for a while. Yeah. Then you'll, focus on is, your staff happy and healthy and then, and it'll rotate. Like it's a natural being, right? It's kind of a circle that keeps moving.
Think of it like a top, right? So as long as it's still moving, you can't fall over.
Yeah. That's good. That's a great one.
Yeah. So as long as it can tilt and it can wobble, but as long as it's moving and as long as everything is sort of have some input, then you're still upright.
Yeah. And you guys both mentioned it, but it's important to have that culture and that client experience from every level of the process, from right when they come in
starts with
starts with the phone call where, how quickly are the staff responding? How quick are they following up? Like, if you get a new patient calling, Googling all the dentists, the top 5 dentists, they're probably going to go to the first person who calls them back. Right. Or the first person who answers. Right.
Yeah.
So that's both, that's great insight. I appreciate, thank you guys so much for volunteering, enjoying this day. I mean, if ever there's a topic you guys want to discuss, anything new, using lasers in dentistry.
Oh yeah.
Yeah. Getting,
fired up,
dabbling in med spa, stuff.
Yep.
But no, I can't thank you guys enough. So thank you, Dr. Edmunds. Thank you, Dr. Marsh. Sure. We'll be really formal at the end.
Yeah, sure.
So for the audience, thank you for listening. Please click the follow button to be notified when new episodes become available. You can visit our website, which will be in the show notes. Like and subscribe. If you enjoyed this episode, share it with friends. Feel free to reach out if you have a topic you would like us to discuss. This is for the audience. This is not just to hear myself talk. Actually, I can't actually watch these after they get recorded or even listen to myself. How many times did I say, but please,
One,
at least one. Feel free to reach out. Topics, feel free if you would like more information about what we discussed here today. But again, thank you guys and enjoy the rest of the day.